What to tell your doctor about wheezing severity? When it comes to discussing wheezing severity with your doctor, you might wonder what specific details are important to share. Understanding how to communicate your symptoms can help your doctor provide the best care for your chronic obstructive pulmonary disease. Let's break down the key points you should mention during your appointment. First, talk about how often you experience wheezing. Is it something that happens occasionally, several days a week, or nearly every day? Frequent wheezing, especially if it occurs most days, can indicate a higher risk of moderate to severe exacerbations. Next, describe the severity of the wheezing sounds. Are they loud or intense? Does it affect your ability to breathe or carry out daily activities? Severe wheezing may suggest worsening airway obstruction, which needs prompt medical attention. It's also important to report any other symptoms that come with the wheezing. Do you feel short of breath, have chest tightness, or notice an increase in mucus production? These accompanying symptoms help your doctor assess the overall severity of your condition. Make sure to note if your wheezing occurs at specific times, like at night or during exercise. Are there triggers that seem to cause it, such as cold air, allergens, or infections? This information can be helpful in understanding your symptoms better. If you have noticed any changes in your wheezing over time, such as it worsening recently or new patterns developing, be sure to share that as well. Changes may signal an exacerbation or progression of your chronic obstructive pulmonary disease. Additionally, discuss your history of flare-ups. Have you had any hospitalizations or needed treatments in the past? Wheezing can be a predictor of exacerbation risk, so sharing this history is essential for managing your condition effectively. Lastly, talk about how your current medications are working. Are your bronchodilators or steroids helping reduce the wheezing, or do symptoms persist despite treatment? This feedback is vital for your doctor to adjust your care plan as needed. By clearly describing the frequency, severity, and impact of your wheezing, along with any related symptoms and treatment responses, you help your doctor evaluate your chronic obstructive pulmonary disease more accurately. This information is essential in tailoring your care to prevent complications and improve your overall health.